to any patient who comes to a hospital. This test is screening test to assess practically each system in our organism. According to our questions, you have to know symptoms of the liver diseases only. But this test is used for diagnostic of practically any disease. That's why we will discuss about every one possible result. So, first of all, we can find kidney diseases. In kidney diseases, we can find renal failure. Renal failure characterized by increased urea and creatinine. Also, potassium level can be increased. Urea and creatinine are main indicators of kidney failure. Kali is potassium. Next, there is kidney disease, which is named glomerulonephritis. One of the types of glomerulonephritis is nephrotic syndrome. Nephrotic syndrome characterized by losing of proteins by urine. Criteria of this disease is hypoproteinemia, hypoalbuminemia, and hypercholesterolemia.
Doctor, can you repeat? Hyperprotein.
Hypoprotein, hypoalbumin, hypercholesterolemia.
So, do you have like the English version?
No,
What's the Russian version?
below.
Below. Is it below?
On-
Did you say globulin?
Globulin is globulin, kind of protein. There are two kinds of proteins, albumins and globulins.
Yeah, absolutely.
So, kidney disease clear? So, kidney failure and nephrotic syndrome. Another disorders doesn't have specific changes, some inflammatory changes. Next disease, which you need to know, it is myocardial infarction. In myocardial infarction, we can find positive troponin tests, positive or increased, depending on type of test system. Next, increased CPK-MB. Troponin in Russian is troponin. It can be written additionally. It's not standard test, we prescribe it additionally. It will be handwritten. CPK-MB. Next one, LDH. These indicators are main, and additionally we can find elevation of AST and ALT. Also, patients with myocardial infarction can have signs of atherosclerosis. Patients with ischemic heart disease without myocardial infarction can have signs of atherosclerosis too. Atherosclerosis in biochemistry looks like increased level of total cholesterol, increased low and very low density lipoproteins, and decreased high density lipoproteins.
Could you please repeat it, sir? Increased level of cholesterol.
Total cholesterol,
Total cholesterol.
low and very low density lipoproteins, and decreased level of the high density lipoproteins.
Decreased value.
High density lipoproteins.
HDL.
Also, triglycerides can be increased, but it is additional criteria and it's not main. Next, we can find liver disorders. In liver diseases, we can find five clinical symptoms. First clinical syndrome which we can meet is jaundice. Jaundice characterized by elevation of bilirubin. Jaundice can be of three types: prehepatic, hepatic, posthepatic. In prehepatic jaundice, we can find increased bilirubin due to increased indirect one. Indirect is very high, that's why total is very high. Hepatic jaundice characterized by increase of both direct and indirect bilirubin.
So indirect is fasting of sheep.
No. In biochemical blood tests, you can meet three different values. Total bilirubin, it is общий. You can meet прямой, it is direct bilirubin, and also you can meet indirect bilirubin, непрямой. If indirect bilirubin is not written, how to find it? Total minus direct. Because of indirect bilirubin is the indirect bilirubin detection is complex reaction, it's cheaper to don't assess it. It's cheaper to assess total bilirubin and direct one. Next, total minus direct.
So how do we assess pre-hepatic and post-hepatic?
Jaundice.
Yeah, jaundice.
Prehepatic is increased indirect. Total and indirect. Hepatic jaundice is increased total one due to both direct and indirect bilirubin. Their value will be close to each other.
What is the normal way of indirect value?
Post-hepatic.
Indirect bilirubin up to total one up to 20 millimoles per liter, yeah. Direct one is up to 5, up to 6, depending on case. Indirect one up to 16. Yeah.
Too much. My patient.
Patient
One more kind of jaundice is post-hepatic jaundice. In post-hepatic jaundice, bilirubin increase due to mostly direct one. Indirect bilirubin increases a little, direct one increases a lot in the post-hepatic jaundice. Next syndrome is syndrome of cytolysis. Cytolysis is death of hepatocyte, destruction of hepatocyte. Cytolysis. Cytolysis characterized by release of liver enzymes to the bloodstream. Main liver enzymes are ALT and AST. So in cytolysis, ALT and AST are increased, and also we can find hepatic jaundice. By ALT and AST, we can suspect some reasons, some kinds of liver disorders. ALT increases more than AST in acute liver diseases.
ALT more than AST in
Acute liver diseases. Or in decompensation of severe chronic. AST is greater than ALT in the chronic liver diseases. So ALT increases a lot if it is acute liver disease or decompensation of chronic. If it is just chronic liver disease without decompensation, mostly AST is greater. Next syndrome. Syndrome of cholestasis. Cholestasis is abnormal extraction of bile. It can be due to mechanical jaundice. It can be due to compression of bile ducts in liver cirrhosis. It can be due to inflammation of bile ducts with the cholangitis, and cholestasis can happen. So cholestasis characterized by, first of all, increase of ALP, alkaline phosphatase, in Russian щелочная фосфатаза. Alkaline phosphatase is main marker of cholestasis. Next marker is GGTP, gamma glutamyl transcriptidase. GGTP, gamma glutamyl transcriptidase. One more marker is LDH, lactic dehydrogenase. LDH, lactic dehydrogenase. Next marker is increased cholesterol. And one more marker, signs of post-hepatic jaundice, increased direct bilirubin. Main marker is alkaline phosphatase, remember. Next syndrome. Syndrome of hepatocellular failure. Previously we've discussed about liver functions, and one of the functions is synthetic function. Due to death of hepatocytes, due to hepatocellular failure, there is loss of synthetic function. It looks like decrease of proteins and albumins, first of all. Hypoprotein, hypoalbuminemia. Level of urea and creatinine decreases.
So what if the protein is normal but albumin is decreased?
Albumin reacts first of all. So it can be hepatocellular failure too. If you will find some additional criteria. But in this test, be careful. Albumin written in the percent, not in the grams per liter. So maybe albumin is decreased because of globulin increase. So hypoprotein, hypoalbuminemia, hypouremia, decreased level of urea, hypocreatinemia. Next, hypocholesterolemia. And there are some additional markers which are from blood coagulation, not from the biochemical blood test.
What's if albumin and protein is reduced, but creatinine and cholesterol is not?
Maybe there are another reasons. Or check for another markers. So next marker is from blood coagulation, prothrombin level. Prothrombin is a floating factor. If prothrombin is decreased, it's marker of the hepatocellular failure too. Prothrombin index is decreased too. It shows hypocoagulation. And one more indicator is international normalized ratio. It's not from biochemistry, it's from the blood coagulation, and they will not be written here. ENR, international normalized ratio. This indicator increases. If you found these combinations or parts of these combinations, it can be hepatocellular failure. But be careful. In hepatocellular failure, cholesterol level decreases. In cholestasis, cholesterol level increases. Patients can have combination of all syndromes, cholestasis, cytolysis, and hepatocellular failure all together. So cholesterol level in these combinations can be decreased, increased, or normal. So cholesterol level is not indicator which we use first of all. Look at another markers.
Cholesterol and cholesterol is the same one.
Same. In Russian, холестерин. According to chemical structure, it's correct to pronounce cholesterol. In English, it's cholesterol. Next, one more syndrome. Syndrome of mesenchymal inflammation. We study this syndrome like a syndrome of liver disease. But mesenchymal inflammation, it is inflammation due to any reason. Due to kidney diseases, due to airway infection, due to anyone. It means this syndrome. Syndrome of mesenchymal inflammation characterized by elevation of acute phase proteins. Main acute phase proteins which we can meet in our tests. Globulins, mostly due to alpha and gamma globulin. C-reactive protein. Some old tests which you can meet in rare cases, but not always. Serum euploid, gaptoglobin, anti-mol reaction. In our cards they are written. In real practice you will not meet it, I'm sure. But you have to remember about them too.
What
Sialic
is
acid, serum euploid, gaptoglobin.
Serum?
Sialic acid, serum euploid, and gaptoglobin. They are acute phase proteins. And one more indicator is indicator from the blood coagulation. Fibrinogen. Fibrinogen you will meet in real clinical practice. So globulins, C-reactive protein, fibrinogen. These indicators you will meet in any inflammatory process. And other indicators are additional. So, how to do assessment of this test on the future control? First of all, for yourself on the paper, note which indicators are increased or decreased. Next, try to combine them to a syndrome. Try to find which syndrome is listed like that. Other kidney diseases, liver diseases, or some other syndrome. Next, when you will find syndrome, you can suspect some reasons. Nephrotic syndrome is disease. It is a type of glomerulonephritis, kidneys failure, liver disorders, and by LTST you can say it is acute or decompensation of chronic liver disease, or it is chronic liver disease. Liver disorders which we will find here, first of all, hepatitis and cirrhosis. We can find another disease too, but they are the most typical. One more indicator I forgot, increased level of glucose. Hyperglycemia, it is sign of diabetes mellitus. So, in this way, by finding combinations of symptoms, you can suspect some disorders. Is it clear how to work with this test? If you need, you can make photo and try to assess them at home. I need to go for patient consultations.
So we will have the paper.
One of them.
Mama?